All right, joining us now is Dr. Tuime Baon, the public health specialist, to talk about this, and is joining us on Skype. Good morning, Dr. Mebaondu. Nice to have you join us now. Now, Nigerians are quite concerned regarding the issue of resumption of school, how prepared we are, whether students should actually be in school, but there's the pitching of the need for them to finish whatever session they were having before. But what concerns do you have?
Well, the concern is this, simply that we are not really understanding and seeing the science behind that decision. But we have seen that indeed there are challenges, but how do we now balance the opening of the society with the data we're saying? Now, we have to put a lot of pressure on the school to ensure that they adhere strictly to some guidelines in terms of ensuring that we don't encourage transmission. Because how we discovered that COVID-19 is transmitted via aerosol, school condition creates such a situation whereby you have quite a lot of people that may be gathered together and be talking, and be sneezing, and be coughing, and be singing, in those cases, leading to the threat. Now, but what we can do exactly is to step up those preventive measures at those individual schools. Now, of course, hand washing, face mask use, minimize interaction as much as possible, and see where we get to. But don't be surprised that if we don't stick to this thing, we might increase the number of COVID cases, and then we will have to go back to all those preventive measures. So the challenge is, how do we assure that those preventive measures are carried out in those schools?
All right, let's look at the numbers that we have been seeing in recent days. Today we have 288, and yesterday I think we have about a little less than 300, or within the range of 300. Yes. So a lot of persons are saying perhaps we are having a case where the numbers are decreasing. Would you say that we are seeing a flattening of the curve when you place this side by side, the level of testing as well as the population?
It's too early to judge that. Let's look at it. In February, we barely had one case. It became 351 in March. It went up to as much as 3,000 in April, 10,000 in May, above 20-something thousand in above 20-something thousand in June, and now we're at 44,000. Now, if you plot this graph, you see that it's a gradual steep increase in the number of cases. Now, the flattening, because again, we're doing testing, especially in Lagos, we're seeing more of those testing happening. But we're not seeing requisite fall yet. We may have to wait a bit, because now what this dynamic is going to show us is simply this, that by the time we now open up the school, and then open up the churches, we're likely going to see a rise in the cases and probably, a correct condition that may enhance the transmission. So I think it's too early. We cannot use 2 days or 3 days data to start judging whether we're flattening the curve or not flattening the curve. We may have to wait for a consistent 1 week to see whether these figures, can go down or go up. And we have seen in other situations, in other climes, where schools were open, and we've seen increase in the numbers of the new coronavirus cases. We saw that at the point in time, even a place like Sweden had to do a lockdown again. Sometimes, some part of Germany had to, go into that. So we cannot look at 1, 2, 3 days cases and say that, no, we are flattening the curve. That's not the way this thing goes.
All right.
Now, we see from our correspondents' details, they're talking about schools reopening. The schools, like we have seen from the visuals we got, the schools are already complying with the directive from government, observing social distancing, checking temperatures. And from what we got from the headmistress today, it's about sensitization. The students will be sensitized on how to keep themselves safe. But one critical issue is the role of parents, especially because it is seen that parents are major role models to their children. What will be your word to parents at this time, seeing that schools are reopening and they are taking their own precautionary measures?
Yeah, it is quite interesting because now we have to face the challenge headlong. Do we keep running away? Do we find a way to open the economy and open the social space in such a way that interaction can further ensure that we don't spread the virus as much as possible? That is where we are now. At this point, yes, we expect the parents to be the key guardian, because they're boarding houses, they are boarding house student, they are day student. At the level of the day student, we expect the parents to be the key guidance or directions on what to do in terms of instilling the message, the critical message of social distancing, hand washing, and even giving sanitizer and face masks to those children as they go to school. That will be quite instructive and then ensure that they are picked up as early as possible. Now, when at the school environment, because again, we have known now that coronavirus can be transmitted through aerosols, especially in closed spaces, okay? At the school environment, as much as possible, we should allow aeration, that the air quality flows around. And then the students allowed, all those sports activities are suspended for now, whereas we just strictly ensure that they're in class, and then after leaving class, they go home as much as possible. And in addition, we must be prepared should we have a spike, or any reason to doubt that the cases are increasing. We must be prepared to actually institute other specific measures in the so-called school or in the community at large to ensure that we don't get this virus up again. So by and large, we'll see how it goes. We just hope that along the line, in the next week, the pattern of the number of new cases will show that we are actually flattening the curve.
All right. So we'll wait to see how the next coming days will be. Thank you so much, Dr. Tuime Baondu, for your time on the program. Thank you.